Back to school time for children means lots of hours looking at the blackboard, and nowadays lots of time in front of a computer screen. If they're having trouble seeing, it can affect the way they learn and play, how they develop intellectually and socially. Here to explain more about watching your child's eye health is Dr. Elizabeth McMunn. Thanks so much for joining us. First of all, you were telling me before the show that the eye exams that we all have had are not really working.
The screenings that are currently being done in the pediatrician's offices and in the schools with the school nurses are only using the big eye chart that we've all seen with the big E, testing the distance vision. And the problem with that is that it's only checking for nearsightedness or myopia. And there's a lot of other vision problems that occur that can affect a child's learning and development that are not detected by those screenings.
So what better tests would there be for that?
Oh, well, starting off, we want to check their near vision. Children are 80% of what they learn through age 12 is through the visual system. So we want to make sure everything getting in there is nice and clear.
Right.
So the first thing we would want to check is the near vision. If a child's unable to read up close or sustain their focusing, keep focusing up close for a long period of time, they won't be able to read for a long period of time either.
So how do you know? I mean, what indicators would you have other than your child saying, I can't really see that? And you were mentioning that they might not always say that, right?
Absolutely. Children are born blurry, so they don't know what it's like to see 20/20 usually. So a lot of times the child won't complain at all. They may complain of headaches or just trouble concentrating in school. And there's concern out there that some children are even being mislabeled with behavioral problems as a result, when really they just need some help seeing up close.
Right. So at what point would you recommend that people say go to the eye doctor?
Right. The American Optometric Association recommends that children have their first eye examination at age 6 months.
Wow.
And again at age 3 and 5, and then every 1 to 2 years thereafter, depending on health issues.
Do you find that most parents are doing that or not?
Absolutely not. Most parents, there's a misconception out there that the screenings that are currently being done are actually eye examinations. I can tell you that most of the parents, when they finally do make it into the office and I ask when was their child's last exam, they say, oh, last week at the school or at the doctor's office. And that's really just that distance vision screening. It's not a comprehensive exam looking at the eye muscles and the health of the eyes.
Right, and you were saying in other states they actually mandate, by law, that these exams take place, the more thorough exams.
There's a number of states, 2 or 3 states at least, that mandate that a child have a full comprehensive eye examination by a optometrist or ophthalmologist before they enter school.
So you were mentioning, okay, the first thing that you should check for is the nearness, the nearsightedness, is that what it is?
I don't like those words at all. Nearsightedness is myopia, and that's having trouble seeing far away.
Okay.
Farsightedness or hyperopia is more trouble up close, but those children may also have trouble far away. And we also want to look for their eye muscles teaming ability. How well do those muscles work together so they can change focus from the board up to their reading materials and things like that?
Now, are these, you know, I mean, parents are always thinking about these. Are these expensive exams that they'll have to take their childs in for?
Well, the cost of the actual exam is negligible compared to what could occur if you didn't correct the child's vision.
Right.
Most insurance companies do cover a examination for children every 1 to 2 years, including the Medicaid Husky programs. They offer examinations and eyeglasses if they're necessary. And there are grants and programs in place for anyone who falls between the cracks and doesn't otherwise have that ability to get the eye exam covered.
Right. It's kind of surprising when you say that, you know, there are 1 in 4 kids can go with undetected with vision problems when there are so many tests out there.
Right. Those screenings miss, I think it's about 25% of children have a vision problem that would affect their ability to learn. And the current screenings that we use, just doing distance, miss at least 1/3 of those.
Wow. So what are, I was asking you before also about computers. So kids obviously are using so much more computers than when you and I were children. What is that doing for their vision?
Well, all that, we did not develop to read at an up-close distance like that for a long period of time. So when you put that much strain on your eyes staring at the computer for a long period of time, issues that were already there but may not have otherwise shown up start to develop. You get headaches, blurred vision, itchy, dry eyes, and it just makes it a little more difficult to concentrate.
So what happens if these problems and these vision issues go undetected and they go untreated? What can happen?
At the younger ages, we say that children learn to read up through age 3 and through 3rd grade, excuse me, and from 3rd grade on, they're reading to learn. So if we do not detect these changes before they hit 3rd grade and learn how to read correctly, we're going to have long-term learning difficulties with those children.
And it has to be, you recommend obviously going to beyond your pediatrician, beyond your school nurse for...
You know, the screenings are very important. We don't want to say that's not an important part of the process, but it is very important to evaluate the entire visual system, not just how well can a child see far away. There are issues, especially now with the increasing obesity, with hypertension and diabetes in children.
Right.
Those will affect the eyes as well.
Interesting. All right, so get your kids into the doctor. That's what you're saying. Thanks a lot, doctor.